All right. Well, I have 9:30 on my clock, so we will continue to let people in as people will definitely join for the next few minutes. But just want to say good morning, everyone. Thanks so much for joining us. I'm Lori Missig, the membership co-chair for Impact 100, and welcome to our fourth and final education series with Impact. We just really want to thank everyone who's participated for the last few calls. And just want to thank you for the positive feedback. So many people let us know what they thought of the events and maybe some other topics that we could do in the future. So it's so important to give us your feedback as we really take it to heart and love to do more of these in the next few months for Impact. Because again, education is so important for our members to really know what's going on, in our community. So the goal of these events really when we started was to gain some perspective on the pressing needs in Monmouth County, and then obviously share them with our members, prospective members, and the nonprofit community. So back in October, Mary Riley on our grants leadership team showed us the Monmouth ACTS assessment. And our county started this in 2016, and then they updated it again in 2020. So we thought to ourselves, we have, the pressing needs taken directly from the needs assessment. And then we asked our past grantees to share their frontline experiences, and everything really came together. So it's been a lot of fun. What we did is we kicked off these events back in December with Susan Kiley, who's our Deputy Commissioner of Monmouth County. And what Commissioner Kiley did was really discuss the Monmouth ACTS program. We got to hear more about, what it is, how they did the assessment, what the needs are, and the services that they're trying to provide to the members of our community. So I want to show you a very brief video of Commissioner Kiley in order to give you a quick idea of the Monmouth ACTS program.
Hello, my name is Sue Kiley. I'm the Deputy Director of the Monmouth County Commissioners, and I am joined today by Jeff Pursley and Mary Pat Angelini. And we are here to talk to you about Monmouth ACTS, which stands for Assisting Communities Through Services. In 2016, we did a thorough survey of the county to understand what things were required by our residents. We discovered that many people had no idea the volume of services that were available to them. And from that came the Monmouth ACTS organization.
In Monmouth ACTS, the Department of Human Services are working in conjunction with the social service agencies that we fund to identify and improve the services that we are offering the residents of Monmouth County.
This public-private partnership is broken into 8 hubs, and we look at anything from behavioral health to housing to child care. We are constantly trying to connect our Monmouth County residents with their trusted community organizations.
In order to access the information on Monmouth ACTS, go to monmouthacts.org or call into our social services office, which has a connection to all of the county resources that you can access, and I hope you take advantage of them.
So obviously that was a brief video talking about Monmouth ACTS, which really is an innovative public-private partnership. It's actually the first of its kind in New Jersey, really bringing together, again, the county and the community partners, hopefully to better the quality of life for our residents. So I think one thing that we kind of learned on the past few calls is that communication has been so important for our community to really let the residents know what's available and where to go for those services. So there are 3 points that Commissioner Kiley really pointed out in December that we've been carrying through these calls. And the first one absolutely is that community information sharing. The ACTS program helps community residents understand what services are available and then how to get that support. And I think that this was pretty evident in our past calls with Fulfill, St. Mark's, HABCOR, Mental Health Association, CFC, all talked about how they work, with the county on a regular basis. Next would be the collaboration and the innovation. So the county was really approaching the human service planning, the funding, and then how to get delivery in a much more holistic way through the public-private partnership. And I think it's times like this that we really found it quite difficult to get the delivery of services, to residents in our county, and that came up quite a bit. And the last point was unmet service needs, trying to address needs through this comprehensive planning process to find out what are we not meeting in our community. So this morning, as I said, it's about behavioral health services for adults. I think one thing that came through on every call so far is mental health is a part of everything. You know, whether you're homeless, you're hungry, we talked about substance abuse, it encompasses everything. And in fact, when looking at the needs assessment, it was the most frequently identified service need by all of our survey respondents. Our mental health distress percentage in Monmouth County was actually higher than the average in the state, according to the ACTS program. So who better to talk to today but some of the women that are on the front lines every day, you know, helping our residents. I'm excited to introduce Dustin Knobloch, Director of Community Education and Advocacy with the Mental Health Association of Monmouth County, which was a 2017 grantee, and Janet Lee, who's a clinical supervisor for 180 Turning Lives Around, which was our first ever grantee at Impact back in 2016. So I'm going to start with you first, Dustin, and go through some questions. And for the audience, we are happy to take questions at the end. You can put them in the chat and we will compile them for the end. Or if you'd like to ask a question live, we'd love that too. So Dustin, let's just start off by talking a little bit about a story that addresses mental health in Monmouth County.
Sure. So there's one story that continually came to mind when I was thinking about this question. There was a family that had come up throughout the county, right? And we actually invited the state to sit in and have this discussion with other providers throughout Monmouth County to really address this family's mental health needs as well as their basic needs. So what we were able to do was we were able to go into the home with other providers and really assess the situation that was happening within the households. There was a lot of pre-existing mental health conditions that had been exacerbated through COVID-19. There was job loss. So there was a significant impact on their financial means. So really being able to make ends meet in addition to being so hard hit as far as mental health, depression, and anxiety. So what we were able to do was actually connect this family with a housing voucher. So they were able to avoid homelessness and eviction. We were also able to connect them to other financial benefits to help with transportation to work. Additionally, we were able to help with, nutrition-based needs and accessing nutritional food. So as of now, this family who was facing an eviction is now actually, this situation has been stabilized and their mental health needs have also been met and have been linked to other supports within the community. And I just think it's a wonderful example of how our county works together and comes together, not just for the bigger arena, but also just looking at one family in need.
That's such a great story because you're right. It's not just one need, right? You had to connect them with so many areas to get back on their feet and be able to sustain housing and hunger, nutrition, all of that. Thank you for that story. We appreciate it. Next, I just wanted to ask, can you share a little bit about, what are other adult behavioral or, mental health issues, and maybe elaborate a little bit on what services are designed really to assess and support the well-being of the adults?
Sure. So we know that mental health and behavioral issues are really those that impact our daily living, right? They impact the way we think, the way we behave, the way we respond, our mood, so on and so forth. And we can appreciate with the pandemic that this has just increased, across the globe, across our country, within our county. So when we talk about the different services that we have in place, certainly we have our traditional services, which includes crisis intervention services, right? So people that are really maybe a danger to themselves or others. We also have family-based services. We have early intervention support services. So being able to identify those early signs and symptoms and being able to engage those individuals into treatment. In addition to those, what we would consider those traditional services, we've really been able to build resiliency through virtual platforms, right? This is something that we're seeing. So we were able as a county to come together and really recognize different or addressing and getting information to specific groups such as educators, clinicians themselves, youth, seniors, clergy. That was a big one. The clergy were really hard hit during this time and inundated within their communities with those experiencing mental health issues and crises, right? So with really focusing on those different areas of our population, we were also focusing on specific topics to include trauma, isolation, grief, kids returning to school, financial webinars and things like that.
Yeah, I think one of the only positives out of COVID was we were able to have this virtual environment, which might get you help faster and talk to someone and some of the services that we wouldn't have been able to get, in that COVID world. Talk a little bit about maybe how many adults experience mental health issues in Monmouth County. Are there any numbers you could put on it?
So the best number that we have isn't necessarily local to Monmouth, but this is what we see across our country, is that 1 in 5 people are living with 1 in 5 adults are living with a mental health condition. So we all, whether if we're struggling with something, we know someone who is. So within that statistic, we are all impacted, right? In addition to that, if we take a look at Mental Health America's screening tool, so you're actually able, and this is another good example of how technology has been used during this time, people are able to log on and take a screening for anxiety and depression. So what we saw in 2020, a 93% increase of adults seeking help for anxiety and depression. And I think that speaks volumes. We also noticed, or the research also showed, that of those who were seeking information regarding anxiety and depression, 8 of 10 screened for moderate to severe anxiety symptoms, as well as 8 in 10 also scored for moderate to severe symptoms of depression. So I think that really shows the shift of what we've seen throughout this pandemic. And like you had shared earlier, through the 2020 needs assessment, the Monmouth County needs assessment, is that we know that people in Monmouth County are struggling with mental health at a higher rate than other counties throughout the state. So it is here. We also know that generally women, are more prone to experience anxiety and depression.
Because women take it all on, right? All right, so talk a little bit about, are there wait lists for services in our area? What are the barriers to providing services that we really need?
So yes, unfortunately, there are wait lists in our area. This does fluctuate. We've really tried very hard in Monmouth County to work across providers to see where the wait lists are and how we can lift these wait lists. We also know that there's a tremendous staffing shortage. So this is certainly contributing to these wait lists that we are seeing. So this is certainly a barrier at this time. Additionally, there's always issues around transportation, right? So if we're working with more vulnerable populations or low income populations, there's always going to be an issue of how to get from point A to point B. And we have certain services in place, but I'll be very honest with you that at times those services can be very difficult to access, okay? We also lack affordable health care. So if you're a single mother making $40,000 a year, it might be really hard for you to pay into your health benefits or to afford, co-pays and things like that, right? Another thing that was shared in the needs assessment, I think that you had shared earlier, Lori, is that a lot of people don't know where the services are or how to connect to the services. So that's really an area where we've been looking at and continue to work really hard in getting the information out to our community to know where and when and how to access the help.
Yeah, and that kind of relates to the next question about the nonprofits, the county, specifically thinking of Monmouth ACTS and the state. How does everybody coordinate their efforts, to get those services out for the members?
So we coordinate in a variety of different ways. Certainly the ACTS has really done a wonderful job with these different hubs, right? These different areas that we've really found that we need to pay more attention to. Just an example that comes to mind, our Red Bank Resource Network, in addition to or collaborating with a local church in Red Bank, as well as the John Bon Jovi Soul Kitchen, which is food-based, we've really come together to kind of take a look at what the needs are in that area and how to best address, what those community needs are, along with stakeholders. So we've sat down with the warming centers, we've sat down with JBJ and our Red Bank Resource Network, and really connected together to take a look at what are the needs of this community and how do we address it. I use that as an example, but that's what's happening in communities throughout Monmouth County. That is how we're working together. And another thought that comes to mind is we actually had a fairly recent meeting with Family and Children's Services to talk about how can we coordinate our services, how can we collaborate, because we have a huge concern for the senior population right now, a huge concern. So how are we able to work together to best meet the needs of seniors and also of caregivers?
Yeah, that's a really great point. And, we touched briefly on the pandemic and how it's really created an increase for mental wellness with depression, anxiety. That 93% stat that you had before is overwhelming. Can you talk a little bit about the increase in Monmouth County? How are we responding to it? Is there anything else we should be doing?
So again, going back to the Monmouth County Acts in collaboration with the Mental Health Association of Monmouth County, we did establish a warm line for those whose mental health has been impacted by COVID-19. So through this warm line, you're able to contact and be connected with a licensed professional for up to 6 free sessions, either virtual or via phone. What I think is really incredible about this program is we were able to contact and put together 70 licensed clinicians who were willing to volunteer their time for the cause. And I think that really just shows what Monmouth County is all about. Certainly that this isn't unique to Monmouth County. We've seen this on a statewide level with Hope and Healing. They have a COVID-19 line, but this is something that the Monmouth County Acts really worked hard on with collaboration of MHA of Monmouth to bring this warm line. In addition to that, I had spoken earlier about the clergy, right? And how the clergy was really impacted during this time. So what we did was, in conjunction with others, we developed this statewide support group for clergy members to come on and have a safe place to discuss what they've been seeing, realize that they're not alone in what they're doing, and kind of bounce ideas and support each other.
Excellent. And really just to round out the questions before I turn to Janet, I think we talked earlier, mental health really affects everything, right? And affects the community at large. Can you talk a little bit about any training needs the community needs? Is there anything that we don't have that you wish, Monmouth County could bring, or anything that we should know about that maybe other areas have?
So what I would strongly emphasize is the need for mental health first aid training. So for those of you who may not be familiar with mental health first aid, it's roughly an 8-hour course, and it's designed to show everyday people. So this isn't unique to clinicians or mental health professionals, how to recognize early signs and symptoms in individuals and how to engage them with services. Additionally, the bulk of the presentation or the training is based around recognizing mental health crisis or substance use crisis in individuals, and how to de-escalate. So it literally takes you step by step by step to help de-escalate that situation, calm that person down enough, and to be able to refer them to the proper professional or supportive services. So again, as a community member, you're not taking ownership of the situation that's happening, nor are you acting as a clinician. You're learning how to de-escalate that situation just enough to get that person in touch with the services that they need. So I would highly recommend, if you haven't taken a mental health first aid course, to look into one. We certainly can provide them through MHA of Monmouth. or bring a mental health first aid course to your community, right? So if you're recognizing that people need a little bit more education and are willing and are open to the education, we can certainly facilitate that. Another thing that I think is really remarkable and that I'm really proud about in Monmouth County is that we've been providing crisis intervention team training to our police officers. So we've enrolled 2 trainings so far. I believe the next one is going to be in April. The goal is to train at least 1 police officer from every precinct in the county. So as of right now, I think we've trained roughly 50. Because what we know is, unfortunately, police, they do respond to mental health crisis, right? And we need to be able to support them if and when this is happening. And we also need to build that, again, we're going back to that word, collaboration. How do we work together? How do we help each other? So I think this is something that's really exciting for our county. And I'll mention, this is a 40-hour thing. So these police officers that are doing this, they're experiencing a full week of some intensive education. And I was privileged enough to be a mental health professional that joined the first training, and I learned a tremendous amount. So what we're doing is really, really wonderful when it comes to the police as well.
Well, what you're doing overall is wonderful, and there's so much need for it. So we're so appreciative for, organizations and people like yourself. I know we're going to head over to Janet for a few more questions before we come back to both of you. But Janet, welcome. Thanks for taking some time this morning. And, same thing as Dustin, can you share a story to help us better understand, mental health, maybe from the domestic violence and abuse side of things?
Sure. I want to thank Impact 100 for inviting me to come speak. We really value our links to the community here in Monmouth and a chance to talk more about what we do and how Impact 100 helped expand what we do. So one case example, I'm going to take it from the program that wouldn't be here today without the Impact 100 assist. This is our Family Justice Center that's located in Freehold. And we work with a range of folks. This particular example was given to me just recently, and I'm going to use it because it's not the usual. This example was an individual who is a male in his 40s, and he identifies as gay, and he was looking for help because of an extremely abusive relationship with his husband, who he had been with for many years and had been abused by for many years. But just recently, the abuse began to escalate into physical violence. And this is what we know. When we have an abusive situation, an abusive relationship, it doesn't just go away. It tends to increase in frequency and severity over time. So we were really glad that Ryan reached out to us. And the reason he reached out was because his local police department referred him. So this is where all the pieces of the community come together. If the police weren't educated to know that males experience domestic violence too, it might have stopped right there, and he might not have made that really important referral to our program in the courts. So Ryan came. At first, I think he did wonder, is this program for me? Don't they just work with women? Isn't it just a safe house? Isn't it for women with children? And as it turns out, he really was surprised by all the services that were offered by the Family Justice Center, which was created to be a one-stop shopping kind of service. Whereas before it was put in place, a survivor of domestic violence might have had to go one place for legal help, another place for counseling, another place to speak to the police, another place to get help with childcare, vocational help, financial assistance. And really, when you have people who are already victimized, we shouldn't have been surprised that sometimes they weren't able to go to all those places and get all those services. So here at the Family Justice Center in Freehold, we embedded with partners working closely with us to have the services right there. We have police officers who come right there to take a statement if needed. We work closely with the victim witness program in the criminal court so that they can assist those who have a criminal case. And Ryan did have both. He had a case in the criminal court, and he had a restraining order hearing in the Superior Family Court. And we helped with both, linking him to assistance. Probably the most important assistance that we didn't used to have is our referral for free, as in pro bono legal representation. And we have made a tremendous increase in our ability to provide legal help to people who truly can't afford it. And that has made a great difference in what happens when these incidents are reported to the police and then moved on to the courts. Often in the past, victims were not represented. Guess who was represented? The abusers were represented. So can you imagine a worse power imbalance than abusers who are already more powerful, confident, leading in terms of their story. And now at least both sides would have legal representation. Made a world of difference. In addition, his name's Ryan, Ryan got advocacy, but also counseling. And we do work with male victims of domestic violence. We find that in some ways they have even less ability to see that the services are there for them. So we open up a lot of portals for them to see, yes, you're entitled to a safe house. In the past, they could not come to our old safe house because we had communal bathrooms. But guess what? We built a new one. We built a new safe house the way we wanted it designed, which was such a privilege because then we were able to say, look, we need private bathrooms. And I think that really assisted the women as well, because the dignity of having a family room and a private bathroom is very different than perhaps more of a shelter feeling where you have to go to a shared bathroom. And that's what we're all about, giving the dignity back to the survivors who the abusers have really stripped down their ability to even feel they deserve anything good. So the other thing we helped Ryan with was financial stability and relocation assistance. So he really received a lot of different services. And in this case, it was all located or generated from the Family Justice Center. So that's my one quick case example. There's been so many people that we do, I really think, transforming work. And one recent client told me, because of 180's help, I can live my life out loud now. I don't have to put my head down and be fearful that everything I do will be a cause for my abuser to control, menace, threaten, or harass. So that's a quick one example.
No, that was such, both of those stories are so great. And the Family Justice Center is an amazing, part of 180 to help so many people. And obviously Impact was happy to be a part of it, but it's come such a long way. And the work that you've done is unbelievable to us. So thank you. Let's talk a little bit about, working at 180 Turning Lives Around. You see the domestic abuse in Monmouth County. Can you share a little bit more about how it relates to the mental wellness of the abuser and also the mental stress it puts on the person, being abused?
Well, I'm glad that you brought that up, because we really want to end domestic violence. Our goals are huge. Our goals are important. It's not enough just to work with the survivors and kind of patch things up. I think in the past, the program was important. It was the hotline and it was the safe house. Very important. But we have grown to realize, in order to stop this pattern of behavior, we really have to look at the whole picture. So now we are working with young people in the schools to talk about healthy relationships. And that's to the boys and the girls and everyone who identifies as gay, lesbian, queer. We have a special outreach program so that we realize they might have particular issues in coming forward, and the abuse in their population is really high. So I didn't put the statistics in yet, but I'm going to put them in right here. 1 out of 3 women in their lifetimes will be in an abusive relationship, according to the statistics. 1 out of 4 men, And 1 out of 2 trans or non-binary people will be in an abusive relationship at some point. Now, we do that broadly, from the teens way up until the elder years. Abuse is not limited to an age group. Anyone who's in a relationship could be experiencing that. So what I wanted to bring forward is that the amount of assistance we give is not just to solve one woman's problem or one man's problem. We really want to get to the root of the problem. And so we do a lot of work with education, prevention, outreach. We try and get involved with the schools. In fact, we're in every school in Monmouth County at the high school level to do these presentations. And I worked with a young person who came in at age 18. And she told me, that she was in an abusive relationship and needed help. And I asked her, I couldn't help it, did you get education on this when you were in high school? Because she just graduated from a Monmouth County high school. She said, yes. And I was really thankful that had come forward. And the truth was, she wouldn't have found me if she hadn't had that educational piece. And she ended up, being able to leave her abusive boyfriend without marrying that person, without sharing a household, without having children, without being financially indebted to that relationship and that person. So ideally, that's where we want to move, is to help prevent abuse from occurring in the first place. We also work closely to be sure that those who are abusive, which could be men, could be women in gay and straight relationships, that they get assistance as well. And there's a Batterers Intervention Program in Monmouth County that serves those who are using abuse in their relationships. As you might imagine, there aren't too many volunteers for that program. So we do have the judges, the courts, the Child Protection Service make recommendations for people to go. And there are a few people who volunteer. And that program really gets to the root of why they feel they need to menace, threaten, harass, control their partners. It's not about anger. Lots of people are angry at lots of people, but an abuser is into controlling their partner, and that's where the difference is. So we really try to work on all angles of the problem. So did I go too far afield, Lori, or did I?
No, this is great. This is great. And those statistics too are overwhelming. I feel like this call, out of all of them, some of these numbers I know, really are higher than I ever thought. Let's talk a little bit about, and I think you showed this in your first example, so because it was such a great example of coordinating everything for Ryan, but when you talk about the nonprofits, the county, the state, is there any other way you coordinate your efforts, for the needs of our residents?
So partly we try to keep both a county and a statewide view, meaning we serve residents, we serve survivors who live in Monmouth County. We also serve those who work here. If it's more convenient for them to come, we are not edging them out and say you must go to your own county. We will serve anybody who comes forward who needs assistance. Now, having said that, we have one statewide program called the Youth Helpline, and that is also one of the preventive programs that we have. And a youth can call it even if they don't have a specific big problem, but they just want to talk things out. Because we know with young people, it can go from a failed test to a feeling of failure, to a feeling of I'll never make it, to suicidal feelings, right? There's very impulsivity that happens in the mental health with adolescents and others. So we like to work on helping people talk out problems before they get huge. And the same with domestic violence. You don't have to be battered to come and get help. It doesn't even have to be a current situation. It could be something that happened in the past. But we are going to provide assistance in how you might be able to get help, whether it was something that happened in the past and you're still very charged or triggered by it, or something that's happened currently. We really want to work with people, not when all hell breaks loose, but even when they're just trying to explore, is this normal? I had a call from a caller, Lori, that said, do the beating stop when you get married? And I said, let's talk. Let's talk. But I think their hope was that if you stand up before their religious beliefs and their people and their church members, that surely behavior would change. And of course, that was somewhat of a dangerous hope. And when we talked a little bit about what makes the difference. And it's different for each person who comes forward. It's not that people want to be abused. We have a lot of people saying, well, why do they stay? And what you have to realize is many times they are thinking that they can make the difference, that they can be that better girlfriend, they could be the more understanding wife, or they can keep the kids quiet, or they could look better, or whatever the abuser is trying to tell them is their problem. But what they find over time is that it's not their problem. It is what the abuser is choosing to do. So there's no amount of change that the victim themselves can do that would stop the violence. But it takes time to learn that, right? And here's another thing. It's not against the law to have hope for your relationship, right? Everybody has hope for their relationship. But what we do is try to work with them and see, would their partner be willing to get help? Are you willing to consider some basic protections in place until that partner gets help? Things like that. And so with the range of mental health issues that come with domestic violence, we also don't want to forget the children, including children who witness domestic violence. They might not have been directly abused, but this is where the cycle starts, Lori. This is where it starts. They see how people in their household solve problems with violence or, menacing behavior. And then as they get into relationships, that's what they think it's all about. So one program we have is Amanda's Easel that really works on the early piece, providing children who have witnessed domestic violence and their non-offending parent a really wonderful place where they work through creative arts to learn about how to handle big feelings and how to have healthy relationships. So we're working on all fronts, not just on the serious abusive end where somebody's already been physically abused. We're trying to work on the preventive side as well.
I think that's so important, Janet, as a big takeaway I know for myself is it's not just the one incident, right? It's working on it from start to finish and everyone involved, and you guys are doing such amazing work. The big topic we always ask, let's talk a little bit about COVID, obviously how it has affected the abuse in Monmouth County, and anything new or different that you had to do to respond to this in the environment we're in.
Well, that's been on our mind, right, for the last 3 years, addressing COVID that we thought might be done in a few months. What did we know? So one thing we found is that, surprisingly, in the beginning of the pandemic, our hotline numbers fell. Less people were calling the hotline, and we were really surprised. And then we began to look closer, and we looked at our website, and we looked at the hits that were happening and when they were happening. And more people than ever were going on our website early in the morning, like 2 in the morning, 3 in the morning. And we began to see that many of the survivors, the victims in their homes, did not have the freedom to get on the phone and talk about the abuse they were experiencing, because so many of their partners were now working from home or had been let go of their jobs and were looking for work but living at home more hours than ever. So we began to see, okay, what are other ways that we can reach out to these individuals who need our help just as much and probably more, because there's more opportunity for that abuse to accelerate and become more lethal in many ways. So we began to put more things on our website, safety planning, information on what resources are there, legal information, so that if they never even got to the hotline, they'd still have a lot of information. And we also looked at our services. And we realized it's not enough to sit in the offices and say, why aren't they coming? And we said, we need to really up our game. And like Dustin said, we moved to more remote and video. We have telehealth phone counseling now. People don't even have to come into our office if they don't want to, and they can get all full services. What we found is many many survivors appreciate that, even prefer it. No childcare put together, no gas expenses, no travel time, no time off from work to try and do all this. So now we were going to hold on to this. The telehealth, the phone counseling is here to stay. We also do video counseling in a protected, secure format, not Zoom, another platform. And we do groups online, we do individual, and we also still offer the individual in person if they prefer. So now there's just so many more ways to get help: telephone, video, in person. So that has really enriched our services, and I believe that will stay. We just need to be accessible. So we also worked with people who called from their cars, who took a walk and called on their phone. We just tried to do whatever we could to reach people where they were. And our numbers have shown that we have really reached a high need population by expanding our ability to provide services. I do have some specific stats from the Family Justice Center from when Impact 100 grant first started. We were able to use that grant to partner with Monmouth County, who provided space for us over at the courts and in an annex building. The funding also helped us boost towards getting more funds from others, because that's how this goes. If you're a happening program, you're able to say, look what we're doing, and then you're able to get more money. So what we found is that from the very early stages, we had just a few clients. Way back in 2017, 2018, about every 6 months, we worked with 30 clients or so. But then between 2018, 2019, we went up to 204 clients. And then one of the most recent full year data from June 2021, which of course was a COVID year, up to June 2021, we served a total of 1,066 clients and provided 2,631 services. Just in that component of our 180 program, just that one program that was helped to be launched by Impact 100. So you see, during the pandemic year, our services have really exploded, and I think that speaks to the need.
Those are amazing numbers. And again, as I said, we're so proud to be a part of that Family Justice Center that's helping so many people. And like you said, came from serving a few now to over 1,000. And that was a great way to end a lot of the questions we had for you, Janet. And I want to turn it back briefly to Dustin to talk about the Impact 100 grant that they received and maybe how it did help with behavioral health services for adults.
Sure, yes. So with our Impact 100 grant, we were able to actually bring Lifeline suicide prevention training to over 160 schools. So Lifelines, for those of you who may not be familiar, is a suicide prevention nationally recognized program that goes into schools and teaches school staff to recognize signs of suicide in their students. And what do we do with that, right? So not only, we know that schools are really the focal points of our communities. So in being able to get the information there, everyone within that school would bring all of that information into their local households and their closer knit communities. In addition to that, we recognize that schools can't do this alone. Right? Schools alone can't manage all this stuff. So we've built collaboration with community stakeholders to build what we call competent communities to respond to trauma and to recognize suicide within our own communities. And what do we do with that? So it's really building on the Lifelines curriculum, taking it into the community and teaching the community to be able to practice suicide prevention, postvention, and really be able to take care of their own. So it's not a constant going into the school or going into the community and retraining. It's the community themselves really recognizing and taking care of their own, which I think is pretty incredible.
Yeah, one thing I'll say, Dustin, I was so impressed with the curriculum, mostly for age appropriate, right? To talk about suicide to the younger kids and how you work into middle school and you work into high school. It's just such an amazing program to talk about a serious topic. Okay, so before we get to, I want Dustin and Janet to talk a little bit about how we can help on the call. I want to share a quick presentation with the group to talk a little bit more about Impact 100. So if you are not a member or not familiar with Impact, I'll just give you a little bit of a background. So we are women of different ages and backgrounds who combine our charitable dollars, our experience and energy to make a tangible difference in our area, specifically Monmouth County. Many people don't know that Impact 100 is actually an international movement. There are over 60 Impact chapters in 3 continents, and together they have awarded over $100 million in the last 20 years. And I think what's super exciting is they're just, getting started. There's so many chapters. I know Impact Jersey Coast feels as though we're just getting started, and we can't wait to award more and more money to the amazing nonprofits in our community. So since we began 2015, 2016 was our first year we awarded our grant to 180. We've awarded over $2 million to 18 high impact projects. So here's how it works. Again, we're a women collectively giving. We each donate $1,100. $1,000 automatically goes to our grant pool, where our local nonprofits will submit their applications for a high impact project. And then we have many volunteers as an all volunteer run organization that does application reviews, site visits, and ultimately will choose the finalists that will present at our annual meeting in November each year. After the finalists present their projects, every member gets 1 vote, and we will vote for what nonprofits they want to award the grants to. So a quick example, we had 430 members last year. We awarded $430,000. And we divided that by 4 grant recipients back in November. I think a few things makes us unique. One is the fact that we're giving away 6-figure grants. Each grant is usually over $100,000. So we're really harnessing that power of collective giving. We kind of say the power of one multiplied by many. The way I look at it is my $1,000 was $430,000, something I could never do on my own. And the second thing is that we aim to fund very specific projects or programs from our nonprofits. So we're looking for our nonprofits to tell us, what is an underserved population that you're targeting? How are you highlighting an unmet need in our community? And do you have a high impact on what beneficiaries? So just a quick idea on how to join. Our membership drive is open. We do close on March 15th for the 2022 class. And you can join in multiple ways. One, you could obviously just donate the $1,100 by March 15th online. We do credit cards, checks, bank transfers, etc. We also have an installments plan. And so as we get closer to March, right now our installments plan would just be 2 payments of $570 each, as long as you did that before February 15th. All of our funding has to be in the door by March 15th in order for us to announce the nonprofit community how much money we will be awarding. And lastly, we're so excited to be able to offer scholarships each year. The scholarship application is up on our website right now, and the deadline is February 18th. Lots of events coming up, a mixture of in-person, wine and cheeses, some happy hours, coffee at Bellworks. And we're also going to be doing virtual events that you can just tune in from home and find out more about Impact and how to become a member. These are all on our website, impact100jerseycoast.org. And lastly, I just want to thank our speakers today. I think it came through loud and clear on this call. Dustin and Janet and your nonprofits are just doing amazing, amazing work every day. And we just thank you for that. So I want to quickly ask Dustin and Janet, just tell us a little bit about what more we could do, to support your efforts, and what would you tell everybody on the call today?
So I know for me in particular, I oversee our community education committee at the Mental Health Association of Monmouth County. And I think everything goes back to education, is informing people of mental health awareness. What does that look like? Which ties into suicide prevention, right? So we look at those courses like mental health first aid, the Lifelines curriculum, crisis intervention team training. How do we support those? How do we recognize areas within our community to bring those trainings to? And we're always looking to have feedback from our community members and participate in those meetings. Additionally, we welcome, people that community members that recognize the need, and we can talk about it through this and filter it through this committee. Another thing that we're really trying to do, and we're encouraging membership in regards to advocacy, is hearing from people with lived experience, right? So we know that we've done a really good job with, destigmatizing mental health, especially through COVID, but it still exists, right? So if we're able to hear from more people with lived experience and how they've been able to stabilize and live meaningful and productive lives, I think that's key. And that's something we need to continue to do more of. So again, it all goes back to education. And if you're looking to get involved, certainly if you can advocate for a mental health first aid course or join our agency at the community education table, that would be incredible.
And from my perspective, one thing I realize is when we talk about 1 out of 3 people being affected in their personal lives around domestic violence, abusive relationship, that means all of their loved ones, friends, colleagues, community members are also touched. So I want everyone to know that in addition to survivors, we also speak and assist those who have been in touch with those who love, those who care for, friends, children and family members who are in abusive relationships. Many times families feel very frustrated and feel they have no options. And sometimes they cut off the victim or survivor at the very time they need more support because they get frustrated and they begin to feel, well, if she knows I only will talk to her if she leaves the abuser, then she will leave the abuser. But we find that's not the case. Survivors need more support, not less support. So I'm just letting you know the hotlines are also available for friends and family members where we can coach you on how you might listen without judgment, how you might help the other person know it's not their fault, how they can share that there is help available. Because we know people often turn to their friends and family before they go outside to a service or professional. And if there is someone who's listening today, or you know somebody who might be interested in getting more involved with 180, we have lots of ways to do that, depending on your interest. We have a very strong volunteer advocacy program with our domestic violence response teams and our sexual violence response teams. And what they do is they help the individual who's reaching out for help at the police station or in the hospital to not have to do it alone. So they will come out and sit with the survivor, and they don't provide therapy. They just provide support, and they provide their presence, and they link them to other services. We also have volunteers that could take part in our community awareness and outreach programs, our special events, our fundraisers. We also have Second Floor Youth Helpline volunteers who help with the young people, and that program that reaches out on the prevention end of things. So if you're interested in volunteering with 180, you can call the hotline and find out more. And I just really want to thank being a part of this program today.
Thank you. All right, I think I'm going to turn it to Ro to see if we had any questions in the chat. Obviously, if you'd like to raise your hand or go off mute and ask questions, we'd love that too. Do we have any questions?
We don't in the chat.
Okay.
Good morning, everybody, and thank you so much, Dustin and Janet, for being with us today. It's so great to hear you present, and thank you for all you're doing in our community. It's just amazing. So any questions, come off mute if you'd like to. If you've got anything to share, any questions, any comments, then feel free, or put it in the chat, whichever works.
I think they did such a thorough job.
Yeah, I know, right?
Information. All right. Well, we will thank everybody for coming. Again, this is our last education series, and it's been a lot of fun. So please let us know some other topics for the future, because I think that these have been really well received. Thank you so much to Dustin and to Janet for everything that you do. And I hope everyone has a wonderful morning. Thanks, everybody.
Thanks for having me.
Thanks, everybody. Thanks, Laurie. Thanks,
Bye,
Mary.
Thank you.